Now, Dr. Rajib Dasgupta is a professor of community health at Jawaharlal Nehru University in New Delhi in India. He joins us now via Zoom to share his insights on how India is forging ahead with this massive vaccine rollout, despite some safety concerns. Thanks so much indeed for joining us, Dr. Dasgupta. Good to have you on the program again.
Hello, Peter.
All right, let's begin with this rollout. A few glitches on day one. Describe what you have observed and what your first thoughts are on this rollout.
Well, India's routine immunization program fundamentals are quite strong. It's grown and matured over the last 2 decades, and a number of states which were considered laggards at the turn of 2000 or 2002 are now some of the finest performers. That being said, this is a new vaccine. This is a new kind of challenge. And these vaccinations are occurring under the gloom of the ongoing pandemic. And therefore, these challenges are new. And an enormous amount of logistical preparations has been going on for months before this launch actually came on 16 January. And till today, about 200,000 immunizations have been done. Most of the adverse effects that were reported are of a minor nature. There were 2 deaths which were investigated by the district committees responsible for investigating adverse effects following immunization, including in one case a post-mortem examination, and as we understand, the other post-mortem examination is planned. And the results or the conclusions of those committee findings is that these are not linked to the ongoing vaccination.
We see the United States struggling to try and reach the numbers that they had hoped to get to in the first stages. Is India looking like it will meet its targets? Because they're quite ambitious.
It is indeed ambitious, but let's remember that the immunization program in India is indeed strong. There are nearly 30,000 cold chain points. The immunization program is a well-oiled machinery. This is a new program. It's a complex program. There are going to be minor glitches in the beginning, particularly logistical and operational, but nothing that won't be fixed. It's just day 2, day 3 yet. And these minor glitches ought to get fixed, and these should be running smoothly.
All right, and in terms of the numbers that they're hoping to reach, what is the ambition and by when?
This phase, which is for 300 million, is scheduled to end by around June, July, which is a period of 6 months. The prioritization strategy is, in this order, health workers first, both government and private sector employees in healthcare, including clinical care, laboratory support staff, and so on, followed by another 200 million of other frontline workers, including municipal workers, waste handlers, police and military personnel, and finally, those above 50 with comorbidities and others with comorbidities. That's the plan so far, and a prioritization strategy on which there is full consensus.
Are there any safety concerns with the rollout itself? I mean, you're trying to immunize the health workers, but somebody has to administer those vaccinations, and I guess in that time, exposure is a risk.
Currently, pandemic phase in the country is at its lowest. The cases and deaths have declined by up to 90% in some of the states which were reporting the largest load of cases. And therefore, this is indeed an opportune moment to launch the vaccination program. And we hope that this would go on without too many complications.
How has India been able to bring down those numbers? What has it been? Is it restrictions? Has it been population compliance? What's happened?
Essentially, a lot of a mix of all these things. The clinical care in most states and cities has been nearly adequate, and nowhere did we have evidence of the health system actually getting overwhelmed, which was a worry given the country's large population. Though behavioral practices show that they weren't adequate enough, as borne out by some of the surveys, limited that they are, nevertheless, as backed by testing data, which peaked around middle of September and has more or less remained at that level. In other words, with the same level of testing, there has been a consistent decline to the current levels. This does not mean that another surge won't happen or can't happen. The health system and the country as a whole should indeed be on guard. But as of now, this is certainly at one of its best points, given the enormity of the challenge.
I suppose this is bringing some reassurance to the Indian population, feeling that something is now kicking in and that many lives will be saved.
That's right. Most activities, barring educational institutions and the entertainment sector, and to a certain extent linked with that the hotel, restaurant, catering industry, barring some select segments, most economic activities have reopened. They are gradually picking up. And there is indeed a general hope, assuming, as I repeat, and as we all know, there are no further surges.
All right, population of 1.4 billion. I guess this process is going to take years rather than months to complete.
Well, this is the vaccination prioritization strategy. And the government's position is that this will be reviewed after 6 months, both with regard to population immunity as well as to the larger pandemic situation and the overall risk. And it's a little premature to talk of what's really going to be the strategy 6 months onwards. But as we know, all across the world, this is an evolving situation. And the program and the policy apparatus will certainly continue to watch it very closely.
All right, so we know that this vaccine has been approved already by the authorities. Will there be continued monitoring and testing of those that are vaccinated to make sure that it's working as it's supposed to?
Yes, indeed, at two levels. One, as we know, that this is an emergency authorization process, and therefore the surveillance of its efficacy will continue to be worked out, will continue to be monitored, the data will continue to get analyzed, plus the fact that, as we were discussing in the earlier part, there's likely to be adverse events, so the adverse events are going to be monitored very closely. We were describing the app, the CoWIN app. So part of the role of the CoWIN app is also to be able to track and monitor the adverse effects, which certainly is a worry with any new vaccine. The AEFI setup is both at the state and the district levels. In both these cases of deaths, the district AEFI committees actually met and responded within 24 hours, including post-mortem examination. And it seems that years of training and caution has indeed borne results. But again, this is early. This is a long phase of at least 6 months in its current shape. And therefore, we do need to watch and be fully alert.
All right, which vaccines are actually being used at the moment? The AstraZeneca one we know for sure, but there was another one that was approved, wasn't it? I think it was the Bharat Biotech vaccine. Is that also being distributed?
Yes, both vaccines are in use. Both are actually licensed under the emergency authorization process. The Bharat Biotech vaccine was developed by the Indian Council of Medical Research in collaboration with the Bharat Biotech, which is one of the vaccine production companies, one of the leaders of the industry, along with Serum Institute of India. So the way this operates is, for logistical purposes, each district is allocated or assigned one particular vaccine for ease of administration and logistics. And therefore, the state or district does not really have a choice, but it will immunize according to the vaccine allocated. The center at which you would get your vaccination is also pre-designated. In other words, the beneficiary or the vaccinee will be pre-registered, and you just can't walk in, and you will also have to be back at the same center for your second dose, and the health workers linked to that center will continue to monitor. That's in brief the operational strategy.
Dr. Rajib Dasgupta, thank you so much indeed for joining us and giving us some insights into this massive rollout, which I think India can be very proud of. So far, so good, and let's hope that it continues that way. Thank you so much.
Absolutely. Thank you, Peter.